Welcome to the JOMA podcast, presented by the Jewish Orthodox Women's Medical Association. Every week, hear from expert medical professionals as they share up-to-date insights on health topics to help you live your best life physically, mentally, and emotionally. Join us as we navigate the ever-changing landscape of healthcare and strive to improve the health of the Orthodox Jewish community.
Welcome to the JOMA podcast. I'm your host, Jenny Berkovich, board-certified pediatrician and director of education at JOMA. My guest today is Dr. Adam Ratner, and we talked all about vaccines, vaccine-preventable diseases. We covered measles, COVID, flu, and it was just one of my most favorite conversations ever, I think. Dr. Ratner is a professor of pediatrics and microbiology at NYU Grossman School of Medicine and director of the Division of Pediatric Infectious Diseases at Hassenfeld Children's Hospital and Bellevue Hospital Center. Having cared for many patients during both the 2018 measles outbreak and the COVID-19 pandemic, he has a particular interest in vaccine-preventable diseases that impact children and their families. All views expressed by Dr. Ratner were his independent views and not those of NYU. I hope you enjoy this episode. Hi, Dr. Ratner. Welcome.
Hi, great to be here. Thanks for having me.
Yeah, we were just chatting before we started the formal podcast that this is probably one of my favorite topics to talk about. But we really haven't addressed it on this podcast in quite some time. So I'm excited to kind of see where things are and what has changed over the last couple of years in pediatric infectious disease, specifically in vaccines. So I'm curious, let's just maybe set the stage. Like, what are you seeing in terms of rates of vaccine preventable diseases in kids? Because I know, like, anecdotally, or what I'm seeing as a general pediatrician, I think may not necessarily be reflective of like reality. So tell me what's going on in the world right now.
Sure. And just to say up front, this is my favorite thing to talk about. Also, I love vaccines. I love talking about vaccine preventable diseases. So I'm excited to have the conversation. Um, I think that things have changed pretty dramatically over the last few years, and we're seeing across the country and also outside of the US, but certainly across the country, resurgences of a lot of diseases that had been under control for a long time. So I think a lot about measles for a couple of reasons. I think it's one of the most interesting pediatric infectious diseases. I think it's very important because measles is our most contagious infectious disease, which means it's an early indicator when vaccine rates start to drop. You start to see little spikes in measles activity before you see spikes in other things because it's so very contagious. And so, 2024 and 2025 already, we have been years of really increased measles activity. So it just in the last couple of weeks, there have been, cases of measles in Texas, in Rhode Island, in Georgia, and these are places that hadn't had measles cases certainly since before the pandemic. But even for thinking of Rhode Island, I think it had been 10 or 12 years since their last measles case. And while a case or two at the level of the state may not sound like a lot, it's an indicator that there is a problem with herd immunity, with the levels of vaccination in the state. And apart from measles, there are other vaccine preventable diseases that we pediatricians worry about that we see every year. I mean, people don't necessarily think of it this way, but influenza is a vaccine preventable disease. And this has been a really active year for flu. It's a bad flu season. There have been 47 pediatric deaths in the US in this flu season so far. And again, in a country the size of the US, the number 47 doesn't sound like a lot. Those are real children, though. Those are like every one of those is a kid with a family, and influenza vaccine is protective against hospitalization and death. So I take every one of those very personally because those are for the most part, the vast majority of those are deaths that could be prevented. And those are kids. That's not even to talk about the thousands of adults that we lose every single year as a result of flu infections. And then I talked about measles, I talked about flu, which is extremely common, COVID as well, vaccine preventable disease. We still see hospitalizations and deaths from that. And then there are these more rare things that I think are also starting to reemerge. So if you look at the generation of pediatricians right before mine, people who trained maybe 15 years before I did, they spent a lot of time thinking about a disease called HIB, Haemophilus influenza type B, which we very rarely see now. It's something that I didn't see at all during my training because we have a vaccine that came out in the late 1980s that prevents it. And HIB is a terrible disease. It's a bacteria that causes sepsis in children. It kills young children. And it used to be very common. It's now quite rare. After going, 30 years of my time as, practicing medicine, I've seen I've seen three HIB cases in the last couple of
Oh,
years in New York City. And so it's I think that these things that used to be less common are becoming more common, and that is all wrapped up in just decreased immunization rates, and it's a scary time.
it's interesting you mentioned flu and measles. I feel like maybe this is just my patient population, or maybe this is something that everybody encounters. But the flu vaccine is the one that is probably the most challenging one for me when I talk to families about it. Not challenging from my standpoint, but challenging in the families wanting to vaccinate their kids. Measles is probably second to that, where there's a significant resistance against the MMR. I'm curious if you've had the same experience, and if so, where do you think that's stemming from?
Yeah, it's interesting. I think the thing with influenza is I think there are two pieces of it. I think the first is that flu is a vaccine that people need to get each year, and the reason for that is that unlike measles and unlike mumps and unlike rubella, unlike lots of things, the flu virus changes each year, and the
It's so
changes
smart. I always tell
it
people it's a
really is.
very smart virus.
Yeah, and the changes can be subtle, but what it means is that the vaccination from last year, while it may provide a little bit of protection, doesn't provide anywhere near the level of protection that people need. So I get my flu shot every year at the beginning of the flu season because I know that I want to protect me and I also want to protect my patients. And every pediatrician I know does that. And my daughter gets her flu shot at the beginning of the flu season every single year because I want to protect her against, influenza. And it's challenging for families because it's different from other things.
Mhm.
And I think there's not always a good understanding of why this particular vaccine has to be given repeatedly. And the second thing is that I think people underestimate how serious flu can
Yeah.
be. And the most severe cases of flu that I've seen, the children who I've seen who have unfortunately died as a result of flu infections were, invariably not vaccinated. And that was a choice
Mhm.
that the family made. And it was because having had these conversations, sadly, many times, it was because they never realized that flu could do that to a healthy kid, to a previously healthy kid. I think people really underestimate what flu can do, in part because when someone has a cold, they might say, "Oh, I have a little
I have the
flu or
flu.
something,"
Yeah.
right? Which is not what we're talking about. Like influenza is worse than that, and there's a spectrum of how bad influenza
Sure.
can be. But it's you're not vaccinating to prevent the little cold. You're vaccinating to prevent the much more rare but much more serious thing that puts your child in the intensive care unit and puts their life at risk. And the problem is
The two
go ahead.
the two biggest, I think, pushbacks I get when I talk about the flu vaccine with patients is number one, I don't know, it's a pushback. It's just something that people tell me. We never get it, right? Oh no, we never get that one. And number two is no, I don't want to get sick, right? The misconception, right? That all flu vaccines are going to make you sick. And it's tough to, I think, explain that that's very much not the case, right?
Right. Right. And I think there's variability. I mean, I think it's important for us as pediatricians to realize that, that sometimes you get a vaccine and you have pain at the
Yeah,
area, of course, because it's an injection, and maybe you don't feel great for a day or so, but that is nothing compared to how influenza makes you feel. Even if you don't have severe influenza that
yeah.
makes you end up in the hospital, like getting the flu is really
Terrible.
no
Who's
joke.
terrible? Yeah.
And I think it is, it can be hard to communicate that. You're
Yeah.
you're right. And I think that is a misconception about the flu vaccine.
So let's go back to measles. I know you've written extensively about it. You've spoken extensively about it. Um, I think if I had to pinpoint like the number one reason where I get pushback on the measles vaccine or right MMR, which is a combined vaccine, is the autism concern. And despite I think like tremendous amount of literature and like publicly available studies that there's absolutely no link. It's something that I think deeply, deeply resonated with people, something that scared people. And as one of my mentors tells me, like it's very hard to unscare someone
Mhm.
once they're scared. So I don't know if that's a similar conversation that you have with your patients.
Yeah, I think that's exactly it. I mean, I think the issue is that the anti-vaccine groups came up with a very easy to understand, three-word thing: vaccines cause autism, and then they're usually talking about the MMR when they're talking about
Mhm.
that. Um, that sticks in people's minds. It's an easy to understand
Yeah,
idea. And I think importantly, it's an easy to understand idea on a topic where pediatricians like you and me don't have a a simple answer to give back to them for what quote unquote the cause of autism is,
yeah,
because autism is complicated.
yeah,
There are different kinds. There are genetic reasons that some people are, develop autism. There are environmental things. There are infections that can cause autism. So children who have, congenital rubella
yeah,
can develop autism-like features, and that is something that the MMR vaccine protects you against. And so it's it is very difficult to have that conversation with a parent and say, well, autism is complicated. There are probably many different subtypes. There are a lot of different risk factors we don't totally understand. You put that up against someone who says with great authority, and great being wrong, but with great authority, that they know what causes autism, and it's the MMR vaccine, and that it is false. It's been looked at in study after study after study over 20, 30 years at this point. And I think it's, one of there are two bad outcomes as a result of that. The first is that it makes people hesitant to get
mhm,
about getting important vaccines. And the second is it, I think, simplifies a problem that is not simple, and it takes energy and effort away from investigations of true causes of autism.
mm.
And that's sad too.
I think when I think about vaccine skepticism, I think of it, at least like in my relatively short career thus far, in kind of like two chapters. Chapter one was before COVID, and then chapter two is now. And I find that the vaccine, I don't want to even call them anti-vaxxers. Many of my patients start a sentence saying, we're not anti-vax, but, right? And then they decline, right, a really important vaccine. And so I have even personally found that the rise of vaccine skepticism has almost like astronomically increased post COVID. Are you seeing something similar? And if so, is there like kind of a light at the end of the tunnel or any kind of resolution in sight?
Yeah, so the answer is yes, we absolutely see that, and it is, it's sad to me, and it's frustrating, and it is really worrisome for what's coming in the future. And I think
Yeah.
that there are two big pieces of this, of why we're in this situation now. And the first is, as you pointed out, is COVID. And I think that there was a lot of misunderstanding and a lot of
Yeah.
anger directed at, pediatricians, adult doctors, public health folks
Yeah.
during COVID. And I think people need a more nuanced view of that. And I think that on both sides of that, I think that, you know, COVID was an incredibly scary time. I worked in a children's hospital for the entirety of COVID. I took care of a lot of very sick patients, despite the people on the news screaming and saying that children don't get COVID and children don't get sick from COVID. That is false. I can tell you with the patients who I took care of myself. Um, and so I think that people came away from COVID instead of being, thankful that we were able to, get vaccines out and protect ourselves before there were vaccines and minimize the still horrible number of deaths and disruptions that everyone went through. I think that people came away from COVID with this anger and this mistrust against, medicine and public health in general. And I think that that has spilled over into distrust of the routine vaccine schedule in kids, and some of that is on purpose. Some of that it was the anti-vaccine groups plan at the beginning of
Mm,
COVID,
wow.
and then the I think that the second thing is that we live in a place where we live in a wealthy country where a lot of these diseases are rare, and a lot of parents have never met anyone who had measles, or never met anyone who had polio or anything. And so I think they underestimate what is at stake, like what the upside of preventing those
Yeah.
diseases is. And I think that that is problematic, because if it's easy, if that's your mindset, to say, oh, well, I think that I've never seen someone with one of these diseases. So if even a question has been raised, I'm just not going to do it. And the problem is that
Exactly.
that is not giving the routine vaccines, is making a decision, and it's making a decision that comes with substantial risks, but you can't see them at the time.
I also think it's a challenging risk benefit discussion if someone is saying, "Oh, polio, I've never seen polio. Why would I, take the risk of injecting this vaccine that has been called into question to protect against something that, as far as I know, doesn't exist?" And the argument to make is like, well, from like a public health standpoint, that's not a good idea. Because I think ultimately parents don't really think that way. They think right at the individual level, like I'm going to do the best thing for my child, and I see that the risk is not worth it.
Right. I mean, the nice thing about vaccines is that they work at both levels. They provide protection to the individual
Yeah.
child, and they help provide protection to the community. And I think that's the other thing that we've seen since the end, since the COVID pandemic, is this kind of overvaluing of individual choice and this undervaluing of how people feel about protecting their community around them. And vaccination is something that we do to protect ourselves and our kids, but it's also something that we do to build this wall of immunity so we can keep things like measles and polio out. It's until measles is wiped off the earth, there's still always going to be the risk that someone will get on a plane, come to a community in the US, or come to a community with a high vaccine rate and develop measles, and that's a measles case in the country. But the reason that it won't spread, if we have good vaccine rates, is that there's this wall around them, and measles can't find enough people to go to continue the spread. But if the vaccination rates drop, as we're seeing them do now, like you need like 95% of the population vaccinated against measles to prevent outbreaks, and we're now at about 93% of kindergartners, and the trend line is going down, which is frightening.
That is scary. Um, I want to ask you about the vaccine injury sort of like database, or I want to call it a movement, right? But there's a database, right, where I think anyone, right, can report an injury, or I guess maybe an adverse effect, right, secondary to
Yep.
a vaccine. Talk to me about that, because I think again, from a vaccine skepticism and resistance standpoint, a lot of families will point to even that existing, saying, well, how can you tell me that vaccines are, right, have minimal risk. There's like a whole database of kids who have been hurt as a result of vaccines.
Right. So this is something that the anti-vaccine movement has really had to tried to have both ways. So there's this claim that comes up over and over again that no one is studying vaccine safety, which is
Mm,
false. And then there's this idea that because there are these systems that study vaccine safety, that means that vaccines aren't safe. And you kind of can't have it both ways. And so the answer is that there are several, not the main one you're talking about where anyone can put data in is called VAERS, which is the
mhm.
Vaccine Adverse Event Reporting System. I'll talk about VAERS in a sec. But VAERS isn't the only thing out there. There are many networks that study of outpatient doctors and of databases that come from electronic medical records and all sorts of things that CDC and FDA and local public health departments use to study potential adverse effects of vaccines. And the reason is that it's really important to find even rare adverse events so that we can communicate with patients so that people can understand risks and benefits. And if you look at something like the COVID vaccine, where there were cases of myocarditis in young men who received the COVID vaccine. They were extremely rare, but they did happen,
Mhm.
and I think that is a real
Yeah.
adverse event in the same way that there was with one of the other COVID vaccines with the adenovirus vector vaccine, there were some cases of blood clots as well. Those were found because of these systems, because of the vaccine safety monitoring systems, even though they occur rarely. And so the reason we know about them is that we do vaccine safety studies. And that's how, those data are out there. And you have to make decisions based on risks of vaccines. There's no such thing as any drug or any treatment that has zero risk, right?
Right.
But what you weigh is the risk of taking a vaccine where the risks are known and are very small versus the risk of not taking a vaccine where it may be harder to estimate that, but the outcomes can be very bad. Like the reason we develop vaccines against these diseases is that these are bad diseases. Um, so to circle back to VAERS, which
Mhm.
you brought up, so VAERS is one of many different systems that are used in the United States for studying and tracking potential adverse effects of vaccines. And what VAERS is a giant database that literally anyone can make a report to.
Yeah.
You can, and there have been silly things that people have done, like someone put in a report to VAERS saying that the vaccine turned them into the Incredible Hulk. Like you can do
It's like
things.
the Wikipedia
Well,
of vaccine reporting.
right. So it's theirs is useful because we really encourage, pediatricians and families who think that where something has happened after vaccination and they think it might be linked, or even if they're not sure, put it into theirs because the folks at CDC who look at theirs will say, oh, we've seen, not one report of this, but a couple of reports from different things in the country. Let's look into that. It's a hypothesis generating machine. It's a database that lets people generate ideas for, hey, maybe this is a problem. We should study this in more detail. And then it goes to other networks that are able to actually look at what the risk of something is. And so if you have someone who gets a vaccine and then they go out and they fall off their bike and they report that to theirs, it's not likely that there are going to be a rash of bike accidents across the country right after getting a particular vaccine. That's something that might be in bears once. Someone would look at it and be like, okay, we're not seeing more reports of this. We'll look back again in a little while, but it doesn't seem like it's a major problem now, as opposed to the myocarditis cases where you might have seen a couple of cases in one place, a couple of cases in another place, and someone said, we should really look at this. And then they go into more detail and then they can say, okay, the risk of this is, 1 in 100,000 or 1 in 1 million or something like that.
When it comes to the current recommended childhood vaccines, like the standard recommended vaccines, I think it's important to call out that these have all been studied extensively for a long, long period of time, right? So I don't think any current childhood recommended vaccine is like under ongoing investigation for right long-term consequence. Is that fair to say?
Well, yes, but so I think that all of the vaccines that are on the schedule have been safety tested, have been FDA approved, but all of them also are part of these safety network things where you could see something using these tools like theirs and like CISA and like the other vaccine safety tools. It's, a vaccine isn't immune from being looked at by those systems just because it's been around for a long time. So if someone thought that there was a problem with the diphtheria vaccine, which been around for, I don't know, many, many decades, um, that might get flagged in bears, that might get studied by CISA, it might, it's something that could be looked at. In the same way, if you have a new vaccine that's just been licensed, it's gone through the phase 1, 2, and 3 testing by the FDA, it's been approved, it's that gets looked at in these systems over years after licensure. So it's a comprehensive system.
So I very often will face a situation where I think of it as like a half win, where I have a family, they will vaccinate, but at their own pace. So, right, we have the recommended schedule that's supported by the CDC, by the American Academy of Pediatrics, by infectious disease societies. We have the standard vaccine schedule where there's been very, very little change, right, over the last couple of years. Like this is kind of where we're at. And families seem reluctant to follow that schedule because of various reasons, right? So common things I hear are it's too many shots at once. I'm worried about so many preservatives, right, all at once. And so they want to space them out. Or in the case of MMR, some families will ask me, can I get like measles? I'll get it, but not as MMR. I'll get a measles shot, a mumps shot, and a rubella shot. So there's a lot of these like alternative schedules and things like that. It's tough for me because I'm just so grateful they're going to vaccinate. So I try to have a risk benefit discussion. But what's really the value of the schedule in its current recommended form?
I think there are two things. So I think the first is the schedule in its current form is the thing that we have safety data for. Like that's the thing that's been studied in these systems. It's the way that things were studied when they were licensed for the most part. And so we know about safety and how well things work at the ages that they're recommended on the schedule. Once you start making stuff up, it we have much less understanding of how well things will work, and we have much less in the way of data in terms of safety. Now, I don't think necessarily that getting a particular vaccine at age 7 months instead of at age 6 months is going to confer additional risk for any reason. But what it does do is it gives you an extra month of being susceptible to a disease that you don't need to be susceptible to. So if you decide that I don't want to give my 1 year old a measles vaccine and I want to wait until they're 4, that's 3 years during which they're susceptible to measles. Um, and it's not a question of the vaccine being safer at age 4 than at age 1. We know it's safe at age 1. It would be safe for a child who hadn't gotten it at age 4, but you can't give them back. Like you don't get a do-over for those 3 years. If your kid gets measles and ends up in the hospital during those 3 years, you've made a bad decision, and it's kind of too late to fix that. So I think that's the two main downsides: the not really understanding the safety and how well things work with altered schedules, and the extra time where someone is susceptible. And then for some of the vaccines, like the measles, mumps, rubella vaccine, there is no monovalent measles, mumps, or rubella. You can't get them as separate shots. So I don't know how you would do that.
It's tough. It's tough to have that conversation with families because I want to accommodate them so much, and again, just so grateful that they're willing to vaccinate. But when we get into alternative schedules, I feel like we're kind of like back at square one and start talking about the risk versus benefits of each one. One of the, I would say, more exciting things that has happened, at least I think in the field for me, is the development of the RSV vaccine. I was a hospital pediatrician when I first graduated residency, so I saw a tremendous amount of morbidity of RSV on little babies. So I was very excited to see that there was a vaccine developed against it. I'm curious if there's anything like any other new vaccines that are kind of like in the pipeline or other things that are in development right now that we can expect to see.
Yeah, I am also super excited about the ability to prevent RSV. I spent many years taking care of kids with RSV, and it is it's something that, for most kids isn't life-threatening, but when it is life-threatening, and that does happen, more than anyone would like. It's very scary, and I imagine you have also seen kids in intensive care units on ventilators from RSV, and I've seen kids die from RSV,
Yeah.
and it's horrible. So now we have two ways of preventing that. There's the maternal vaccine during pregnancy, and there's the monoclonal antibody, the nirsevimab antibody that kids can get after birth. And we usually do one or the other, but they both work great. Um, so yeah, so that's a really important and good thing. There are a whole lot of vaccines in development. I'm always in awe when I look at the vaccine schedule, just because we can prevent so many more things now than we could when I was, when I was training. And I think about all of the kids who I saw with rotavirus diarrhea admitted to the hospital every winter. The place would fill up with kids on IV hydration, and we don't see it anymore because we have a great vaccine against it, and that's really nice. Um, New things that I think are in, fairly late stages that are exciting is, I'm hopeful that there may be a norovirus vaccine in the coming years, which would be great. Um, I think that there is a lot of work going on right now for an influenza H5N1, the bird flu vaccine, because I think what's going on with bird flu now is very worrisome, and I'm worried that there will be large outbreaks of that. Um, and I think, and there are a number of other vaccines that are in development as well.
I want to ask, I want to end by asking a question I try to remember to ask all of my guests, which is from a, preventative health standpoint, what is kind of like the one message, or if you had a chance to like stand right on a world stage and have a microphone and like share the message of prevention, what is like the one thing you wish that people would know?
That the public health successes that we enjoy, the fact that we no longer have so many people die in infancy and in early childhood. Like it used to, if you go back and you look at records of families from 100 years ago, 200 years ago, it was common for children to die. And it is no longer common for children to die. And that progress is not guaranteed, and that progress rests on public health and in large part on vaccines. And the reason that we vaccinate against the things that we vaccinate against is exactly that, is to protect kids from things that are life-threatening in early life. And we've been incredibly successful, but those things that we're protecting against, with the exception of smallpox, are not gone. Um, and we mess around with not vaccinating at our peril. And I think that is the message that I would communicate.
Amazing. Dr. Ratner, thank you so much for your time today, and thank you for the amazing work that you are continuing to do.
Thanks so much. It was great to talk to you.
Thank you for listening to the JOMA podcast. We welcome your feedback and ideas for future episodes. Send us an email at health@joma.org. Don't forget to subscribe, rate, and review us on your favorite podcast platform.